Breast augmentation is a procedure often utilized to increase your breast size or increase your upper pole volume. This can be for a number of reasons, possibly because you had relatively small breasts and then you want to do something about it, or because there's been changes, typically since a pregnancy or after a weight loss, where there's a loss of upper pole fullness and you want more oomph to your chest. This can be done with one of two kinds of implants, either a saline implant or a silicone implant. Talk to me about which would be best in your particular case. Each implant has its own advantages and disadvantages. There's various incision options. Most commonly it is performed under the breast along the inframammary fold. And then it can be placed either above the muscle or below the muscle. And again, the location of the implant would depend a lot upon your anatomy and your level of activity. Again, talk to me about that when we meet in consultation. Recovery after breast augmentations tends to be relatively fast. Many women are back to work in 3 to 5 days. Usually you can expect to be back in the gym in 2 to 3 weeks. Obviously these amounts vary from woman to woman, but in general, we try to get people back to work as soon as possible and then expect them to kind of take it easy for a while until things have settled down and the healing has started. As with any surgery, potential complications involve bleeding, infection, hematoma, seroma, undesirable result, or bad scarring, altered or lost sensation to the breast. Unique to breast augmentation is the possibility of loss of the device. If there was an infection, then sometimes the device needs to be removed, let the infection clear for several months, and then return and replace the device. One of the unique aspects of breast augmentation is that there is a device placed into your body. It is considered a permanent device, but it won't stay there forever. Just like the tires on your car wear out, so will the implants, and it is very likely that you will need some sort of a revision surgery to replace the implants at some point. Typically it's years, it can be decades afterwards. The most common long-term complication is capsular contracture, followed by rupture. Every surgical procedure has the possibility of complications. There's no guarantee you'll be happy with the result. In fact, there's almost no guarantees. I want you to get the best result possible. We take these surgeries very, very seriously, and every single surgery is performed at an accredited hospital. These aren't performed at some fly-by-night clinic or some strip mall. These are all accredited hospitals with anesthesia supervised by physicians. One unusual thing about breast augmentation is that it seems like everyone has an opinion as to what a woman's breast size should be. And I think it's extremely important that when you come in for your consultation, be as selfish as possible and be as honest as possible with me to discuss what you really want, what your expectations are. I may not be able to meet your expectations, but if I don't even know what they are, it's difficult for me to either tell you what you can expect or even whether you'll be satisfied with the result. Unmet expectations are a common source of dissatisfaction, and it's always disappointing when a procedure is done well and you're still unhappy. And so it's important that you be as honest as possible. Much like Vegas, what's discussed in a consultation stays in that consultation. If changing your breast size is something that you think you might be interested in, please come see me in consultation so that we can tailor a unique program designed to meet your needs and your desires.